A new report says hospice care in Vermont dropped slightly last year. Advocates say that means more terminally ill patients aren't getting a benefit that could help make the end of their lives easier. I spoke with Dr. Mary Reedy, the hospice medical director at Caledonia Home Health and Hospice. She is the co-recipient of the 2023 Madison Dean Excellence for End-of-Life Care Award. And I talked with her recently about end-of-life care and why she's passionate about hospice care.
There's something which we call the surprise question, in which they should ask themselves, would I be surprised if this person died in the next 6 months? If the answer is no, they should come on hospice immediately. Because the longer we have someone on hospice, the more we can do for them and the more they can enjoy their lives.
Dr. Mary Reedy says she thinks anyone who's terminally ill can benefit from hospice care, but patients should think about it beforehand so they're ready to talk to their doctor about it.
It's really hard to interrupt that flow of treatment unless you've had conversations about hospice and the burden of care and what do you want. I mean, I love living in the Northeast Kingdom because there are a lot of people here, an unusual amount of people here, who as soon as they get a terminal diagnosis say, that's okay, thank you for telling me, now I'd like hospice. You know, it's so well integrated into our community. We've really worked hard in the last 15 years to get rid of the stigma, to get rid of the taboo of hospice and say that hospice, sounds weird to say, but hospice can be fun. I mean, we try to help people have a full and meaningful and active life as long as they can, you know, right up until their very end.
She says hospice can help prepare someone for the end while still encouraging them to continue doing what they love.
And one of the most important things that I feel like I do is to try to break down the fear of dying and to try to normalize dying and to try to remind people that they're still here trying to normalize this time in our lives and honor this time in our lives and make it less scary, because if people are less scared, so much more joy can happen, so much more connection can happen.
What can hospice do then that traditional medical care can't for that patient?
So much. Hospice really helps people live their best lives. I think that the quality of life for someone on hospice is improved when they make little tiny goals, like I want to go to Maidstone Lake and swim in it one last time. I want to go to Miss Lindenville Diner and have my favorite breakfast one more time. Those little trips and treats are so good spiritually and emotionally for the person who's dying and their family. I want people to know that when you're on hospice, you're still living. And we're here to help people live the best they can.
And tonight in my report at 6, you'll hear more details about what hospice does and doesn't do for patients at the end of their lives. And you'll also hear from a widow who says the care her late husband got through hospice made a world of difference for their family.